Welcome to Danish-InfoNews TV. In this special edition, we uncover a growing crisis inside Denmark's child protection system. A private care provider, a manicare, entrusted with society's most vulnerable, is now under investigation for ties to organized crime, illegal child placements, and serious breaches of public trust. Definition of a care facility, bosted, in Denmark. In a Danish context, a bosted refers to a residential facility where individuals with special needs, often children, youth, or adults with physical, psychological, or social challenges, live and receive daily support. Types of care facilities, approved care facilities. These are subject to official supervision, social tilsyn, and must meet requirements regarding staff qualifications, physical conditions, pedagogical methods, finances, and management. Unapproved care facilities, for example, for emergency placements, used in acute situations, typically up to 3 weeks. Here, the local municipality is responsible for oversight, not the national supervision body. A care facility is not a hospital or medical treatment center, although some healthcare may be offered. A standard dormitory or youth housing, a medical institution with full clinical treatment, which requires separate approval. Typical residents include children and youth experiencing neglect, ADHD, autism, or developmental disorders, adults with mental health issues or substance abuse problems, individuals with disabilities who cannot live independently. Police sound the alarm. Scandal-plagued care facility has close ties to criminals. A manicare is a non-approved care provider housing vulnerable children in Denmark. Investigative reports by TV2 Østjylland reveal illegal placements and poor conditions. Police concerns East Jutland. Police alerted authorities that a manicare employee has close ties to criminal networks. The warning was sent to Social Supervision MIT and Aarhus Municipality. Expert reactions. Legal expert Eva Nauer calls the situation deeply concerning, noting the risk posed to vulnerable children. Lack of supervision in non-approved facilities is a major loophole. Misleading practices. Municipalities paid millions to akut-anbringelse.dk, unaware the care was outsourced to a manicare. Both companies accused of using false credentials and manipulating authorities. Ringsted Municipality filed a police report after paying 10 million Danish kroner for illegal placements. Child testimony. A 12-year-old boy, William, described a time of neglect, verbal abuse, and instability at the facility. Oversight gaps. As a non-approved provider, a manicare operates outside formal regulatory control. Local municipalities like Norges have no legal authority to intervene. East Jutland police have sent a letter of concern about an employee at the company a manicare. Yet another serious issue has been added to the list of problems affecting the scandal-ridden care home, a manicare. For months, the facility has been at the center of revelations by TV2 Østjylland and harsh criticism from experts. Now, documents obtained by TV2 Østjylland through a Freedom of Information request show that East Jutland police are expressing concern. It involves an employee who allegedly has close ties to the criminal environment. This is stated by East Jutland police in a letter to the Social Supervision MIT authority. The company manicare is a so-called non-approved care facility that has been responsible for vulnerable children, including at a house in the small village of Homa near Grenaa. TV2 Østjylland has uncovered that several children were placed there illegally and under highly questionable conditions. The director of a manicare, Mahmoud Haloum, declined to be interviewed about the cases. I am not aware of the alleged matters and have full confidence in the authorities. If there had been any grounds, the police would already have acted. We naturally always obtain criminal records and child protection clearances for our employees, writes Mahmoud Haloum in a written response to TV2 Østjylland. Police warning. In a letter of concern, the police describe a specific manicare employee with the following words. East Jutland police have become aware that name redacted at the social care provider a manicare apps has close connections to the criminal environment. The police's communication follows a long series of serious revelations about the company's management and operations. It is very noteworthy that the police are reaching out in this context, which certainly indicates they are very concerned, says Eva Nauer, associate professor in social law at Aarhus University. She considers it potentially deeply problematic that individuals with criminal connections can gain access to some of the most vulnerable groups in society. It's a red flag if you have employees with links to the criminal world, says Eva Nauer. Millions to the company. The information from East Jutland Police has been sent to both Aarhus Municipality and the Social Supervision Mid-TE. When the police raise such an issue, you obviously need to investigate whether there's a valid reason to be concerned about this employee, especially since they have daily contact with vulnerable citizens, Eva Nauer explains, continuing, so it's not acceptable if you have an employee who is possibly criminal themselves or so closely linked to the criminal environment that it poses a risk to the citizens. As previously revealed by TV2 Østjylland, it's actually the company Akut-and-Bringelse.doc that several municipalities have paid millions of kroner to care for emergency-placed children. But the task has, in several cases, been outsourced to a manicare, without families or municipalities being aware. And this is the company now being linked to the criminal environment. TV2 Østjylland presented the information to a manicare director Mahmoud Haloum and Akut-and-Bringelse.dk director Michael Thompson. Both declined to be interviewed. I am confident that the police and the Social Supervision Authority have handled the ongoing inquiry professionally and according to internal procedures. I note that there has been no direct communication to us in that regard. I have no further comment, writes Akut-and-Bringelse.dk director Michael Thompson in a written response to TV2 Østjylland. TV2 Østjylland asked East Jutland Police about their concerns regarding a manicare. East Jutland Police, however, are unable to answer questions about the letter sent to Social Supervision MIT or questions about named individuals or companies. We cannot comment on whether there are specific investigations ongoing related to the mentioned individuals or companies, writes Communications Advisor Ann Tiedemann from East Jutland Police in a written response. Local concern, according to the Business Register, a manicare is based in Aarhus Fiv, but the company has long used a house in Homa near Grenaa for placements. This concerns Kasper Bjerregaard, V., mayor of Norddjurs Municipality. I find it completely unacceptable that we are in a situation where such a care facility can be established here without us being informed. I've said this before, and I firmly stand by it, says the mayor, who previously reached out to the Minister for Social Affairs and Housing, Sophie Haystorp Andersen S., about the issue. Since a manicare is a so-called non-approved care provider, it falls outside the control of the Social Supervision Authority. Norddjurs Municipality also has no authority to act. There's really nothing I can do because these kinds of facilities can be set up if someone wants to. It's just an unfortunate and clearly unacceptable situation, says Kasper Bjerregaard. No oversight. The two companies are so-called non-approved care providers. These are facilities that municipalities can use in emergencies for urgent placements. Children can be placed for 3 weeks, with a possible 3-week extension in exceptional cases. Such providers are not required to meet the approval standards of the Social Supervision Authority regarding staff or education. Only the placing municipality is required to conduct direct oversight of the care. In the cases uncovered by TV2 Østjylland, children were placed illegally in the company's care for many months, in one case over a year. Manipulation and neglect. The information about possible criminal ties comes on top of revelations that Mahmoud Haloum and Michael Thompson provided false information and titles to municipalities. This led to them being reported to the police by Ringsted Municipality, which paid 10 million Danish kroner for them to care for 3 emergency-placed children. The municipality accuses the leadership of manipulating and deceiving them during the placements, which have been ruled illegal by the appeals board. Ankestyrelsen. One of the children, 12-year-old William, told TV2 Østjylland about a disturbing and chaotic time at the facility, a time marked by neglect, verbal abuse, and numerous relocations. They called me a loser and a fat pig, William said in a previous interview. Oversight of care facilities. Serious failures in patient safety. The Danish Patient Safety Authority is responsible for patient safety oversight at care homes, where staff handle medication or provide treatment. But recent data reveals that a significant number of facilities are failing in critical patient safety areas, repeatedly. Who oversees patient safety? Official patient safety oversight applies only when healthcare services are provided at the care facility. In emergency placements at unapproved facilities like a manicare, only the local municipality is responsible for supervision, and this is often where patient safety oversight breaks down. Conducts medical and patient safety oversight at care facilities where treatment is provided or staff handle medication. Focuses on patient safety and quality of healthcare services. The Social Supervisory Authorities, Social Tilsyn Mid-T, Social Tilsyn Nord, Social Tilsyn Syd, responsible for social oversight of approved care facilities and social services. Ensure that facilities comply with legal requirements regarding quality, pedagogy, staff, and environment. Municipalities have supervisory duties especially regarding non-approved care facilities and emergency placements. Must ensure that the child or citizen's safety and well-being are secured even when the facility is not officially approved. Alarming findings on patient safety. In 2022, 39% of inspected care homes had serious or critical patient safety issues. In 2023, inspections showed 50% lacked basic documentation essential for patient safety. 47% lacked health overviews critical for safe care. 36% failed in proper medication handling, a key patient safety concern. Repeated patient safety failures and weak consequences. Although the Patient Safety Authority issues orders when violations are found, critics argue that inspections are often announced in advance, giving facilities time to hide shortcomings and temporarily improve safety conditions. Private care providers receive significantly more patient safety warnings than public institutions. This is not just system failure, it's a breach of trust against the most vulnerable in our society. Eva Nauer, Associate Professor of Social Law, Aarhus University. Lack of patient safety oversight and evidence of deception. Users and relatives report that some institutions falsify information and lack professional standards. Many facilities prioritize profit over patient safety and quality care. Far too many care facilities fail to meet their patient safety obligations. When patient safety oversight mechanisms fall short, vulnerable citizens, especially children, are left in the hands of a system with little to no real control. This is just the beginning. Your voice matters. Follow Danish-InfoNews TV for ongoing coverage as we dig deeper into the care system's darkest corners and hold those in power accountable. Like, comment, and share to make sure the truth reaches even further.